Hi friends, welcome to my channel. I'm Julie, and in this video I will be talking about 10 tips for all the new moms and dads out there. I hope this is helpful because these are just based on my experience of being a mom for this now 9 months, going to be 10. And if I had these points, it would have made a difference. Of course, it would have made me a lot calmer. So I hope this helps. Let's get started. First point. Now it's quite a big notion, that babies do sleep long hours and it's supposed to be that way, but it's actually not the truth. Majority of the kids out there don't sleep in the first few months. They have different factors, of course, but what we can do as moms is to help them sleep a little better. Now, a few things I can suggest is using white noise. Now, white noise is something that's quite used nowadays. It's getting to be aware to a lot of parents, which is noise which is constant. Now, you can use the noise of the fan, you can use the noise of the old AC, which makes a lot of noise, and another one you can use this white noise based on the internet, which is YouTube. YouTube has a lot of collection of white noise, which is can be included from rainfall, or waves, ocean, and so on. So white noise can be really helpful because our kids are so used to hearing noise inside us that they expect to be sleeping off the same way out in this world. Next thing you can do is rocking your baby. Now when you rock your baby, it gives them such a comfort and they sleep off. Now what I did for my baby, which is not advisable, but what I did to make my life easier, was to feed my baby and I used to hold him in my arms and I used to sit and sleep. I know it's not a comfortable, but if you could afford a good set of pillows, you can keep yourself comfortable and give a support to your arms, and you can give your baby a good sleep as well as yourself, because if your baby sleeps, you need to sleep as well. Second step. Now babies don't necessarily cry because they're sleepy or hungry or they're feeling cold. They also cry for tummy pain. Now tummy pain is something new, right? Have I heard? No, I haven't, and I'm sure a lot of parents haven't heard about their kids crying for tummy pain. That was so young. They just feed on what? Milk. But that's a surprising fact. Whatever they get fed on, they need to pass out the gas that's formed when they're feeding. Now that can be only helped once you burp them, or even rocking your baby can help. What you can do is hold your baby onto your chest and then rock him or her. And that movement, or I won't say friction as such, but the movement on the chest to the chest of the baby can actually push the gas out, and that really helps the baby. Now burping the baby, there's two methods which I worked with my son, and that was again on the shoulder. Now when I say on the shoulder, over here, not over the shoulder but on the shoulder, and you pat him, and that really helps. Even the lap, keep your baby's tummy near the chest onto your lap, right, and pat him or her, and that really helps the baby. Third tip, all babies have a soft spot. Now when I say soft spot, that is again surprising. It's a small hole. I won't say literally a big hole, but a small opening there. Of course there is enough tissues to hold it enough, but what I can advise is you should be aware, because when you gently touch, you might get scared. Don't be scared, because that's a natural thing. Every kids have it. Now what you can do is you can gently touch it. Of course not to per se touch, but when you clean him or wipe his head off, give him a bath, you can do that. But don't press on it, because I'm sure we don't do it, but there might be some curiosity for certain. Now the fourth tip, breastfeeding is going to be tough. Yes, I said it. Breastfeeding is really tough in the first few months. So breastfeeding is not going to be easy for a lot of moms. The only solution is proper positioning. As days go by, you will learn how to position your baby better, and once the baby knows to latch properly onto the breast, then your discomfort will go off completely. Now there are different lactation consultants out there in the hospital, but if not, learn to position your baby in such a way that you're comfortable, so with the baby will be comfortable and the feeding will go beautiful. Now there is another part of breastfeeding that's your discomfort, which is when your breast is filled with milk. The milk ducts in our breast is filled. There is a lot of pain or discomfort. For some it's just a little tingly feeling, and for some it's a little more painful. So bear with it. After your breast gets used to it, it gets normal. Remember, breastfeeding is not just for feeding you, it's also for soothing your baby. So remember, just because your baby is crying, feeding is not the only reason, but comforting can be also part of breastfeeding. Fifth point, motherhood is going to be scary. It is a natural feeling, and so was our grandparents and our moms and anyone out there. It's going to be scary. Everyone has an opinion, but what I can advise is, as days go by, you get to learn different things, you get to be more confident. Everyone has an opinion of how to take care of their kid that way and so on, because every parents have their own method. But go with your gut feeling and choose what you feel is right. Of course, you have a feeling that you need to ask the doctor, go for it. If you don't want to ask the doctor, don't go. It's about being a mom, and again, there's no right and wrong in parenting. Everything is right for their own kids. Just make sure you give them love and take care of them. Sixth point, try to find a support member. It can be your husband, it can be your mom, it can be your sister, your friend, anyone out there. Someone who can help you out so that you can take a break at least for half an hour or 1 hour. Now, I'm not saying that we all need help, because I was a stubborn one, and I accept I'm a stubborn one. I want to take care of my kid, A to Z. I knew what was right, and that is how I am still. I am a little more calmer right now on that topic, but I still believe that I need to do everything. But there are times when you need a break, and I advise you to please go ahead and make sure you inform anyone of your support member to be ready that when you need to pamper yourself, when you need to go to the restroom, you can't always take care of the kid. So call them in and make sure that you give them the kid and you take a break. Now, we are all humans at the end of the day, so taking a break for once a day or twice a day is not going to make you less of a mother. It's going to make you much stronger, because if you keep a lot of stress and get frustrated more, it's going to burst out. It's rather being a happy mom, but then your kid will be happy. So it's very important. The seventh point, documenting your kids' growth. Now, this is quite important because I haven't. Of course, it's a quite normal thing that you do a lot of photo shoots and take photographs. But my point is, take a photograph or a video. Yes, especially a video on your own personal mobile. Why I say is that I used to do that once a week, and I used to do it unconsciously. And after a while, when I used to browse my pictures and the video, I'd be like, the difference of your baby and how much it's grown, and makes you proud as a parent. So you would thank me for sure. Just remember, whenever you get your phone with that, instead of going through WhatsApp, take a few pictures of your baby and it will make your day. Now, the eighth point, umbilical cord. Now, umbilical cord would of course come off. That's how it's supposed to after a few while. My son had a situation where a little of oil was on it. Of course, it doesn't have to come off as an infection, but it did. And what I could find out from the doctor was keep it dry. Now, the ninth point, drink a lot of water. Yes, drinking water is important, like you always cleanse your body, but if you're breastfeeding, drinking water is essential. You need to eat well. Of course, you can have your junk food at once, because I can't stop you, because I do still have. But having good food can also transfer those nutrients to your baby when you breastfeed them. And make sure you also have your multivitamins, because till you breastfeed your baby, multivitamins should be part of your regular diet. And I won't consider that as a diet, but a supplement, of course. The 10th point, which is the last point, you should know that your baby's first poop would be of tar. Yes, it looks like tar, exactly like black tar color. Now, this is going to change, of course, as they feed them more. The color will change into a mustard or yellow color. Now, that's again natural. Different kids, based on the formula milk you give them, the color can be a little green, a little yellow. But if you have a little, feeling that you need to consult with the doctor, please, you won't be calm until you get a word from the doctor. These are the points I could talk about today in this video, and there are more points, of course, to add. There are not just limited information. I hope that you love these points and it will really make a difference to you. And on that note, I would like to end this video by saying that to all the moms out there that are feeding need to take every day as it comes. Take one day at a time. Of course, taking a routine in your life is important. But if it doesn't work out, don't get yourself frustrated, because just because one method worked with one friend's kid of yours, it doesn't necessarily have to work out with your kid. Every kid is different. Let's love them, of course, be patient, relax a little more, because being a happy parent makes a happy kid. I believe in that. If you're frustrated, nothing works out. Even the easiest things gets a little harder for you. So let's support each other, love each other. Love more videos on this. Please let me know in the comments below. Let me know if you have any questions which I can help you in a basic mother-to-mother conversation in the comments below. And it was nice again to talk to you all. I love you all. Take care. Bye-bye.